Thank you, everyone. My name is Weihong Huang. I'm from China. And probably 4 years ago, I was in London. So we started about in diabetes remote monitoring in 2005. That was the beginning of mobile health. But today, we are going to be talking about smart care. I shaped that a little bit, like examples of large-scale AI and smart care execution in China. Probably not to speak about the largest. Not very good. So first things first, contents for today's talk. Rethink about smart care. We have to understand what we cannot do rather than we can do. This is something similar to when we talk about the Brexit, you see. Second thoughts about the smart care. That's the first thing I will talk about. And then we will try to find out the new service models and then give you a little bit examples of the real scenarios we are doing in China, not only in big hospitals, but also to try to help the rural areas and then people in poverty. And then we try to explain a little bit the foundation in big data that is going to be important for us to empowering the artificial intelligence. And then a bit about the future work directions. First of all, who are we? We are from China, one of the top hospitals. And then we are the first and only mystery key laboratories in health information technologies of China. And we are based in a hospital with 3,500 beds and serving about 100 million people in southern China. That's where we are, in southern China. And that was actually built in 1906 by Yale Association, about 123 years ago. So, when we say things in hospitals, we talk in their languages. We are not going to be the professionals in IT, but we try to be nurses and doctors' friends. So, they talk things in Pico. We have to learn their language. That means we have to put our technology in the Pico context. When we say that, smart care, we care about 4 things. The first thing is about our participants in our projects. Who does it serve? Who do we work for and how does it work? And then can it change something? And can it really help in the health and care? So this is the first thing. We have to think about smart care in that context. And we put that in a new service model. This is my invention. And then we put I2A2 or double I or double A. The first I is intelligent. The second I is interactive. And the first A is accessible. And the second A is affordable. So, we're going to be presenting a couple of real scenarios. The first thing is smart skincare with image recognition. And then the second thing is OR room assistant with voice and gesture recognition. And the third intelligent case is medical history collection with natural interaction. And then we have the other 3 as well, so we do that one by one. The first thing about skin disease. Everybody have kind of skin itches, and some of them could be fatal, just like melanoma, that's skin cancer. And then some of them are going to be very, very easily be ignored. So, what can we do? We are going to do something very interesting. Try to find out the important symptoms from the beginning. And then we trained our data with over 800 clinical images of 9 common disorders, including psoriasis with the same person's electronic medical records from the hospitals. So we try to do that in early detection. Remember, we don't have to rely on the dermatoscope. We just use our mobile phones. So, what will be the result? This is the interesting point. In that right-hand figure, it shows that it is comparable to some experienced doctors, in skincare. We call it dermatologists. So that's a very interesting experiment. And this is how we put that in practice. And we try to do the severity grading when it's very, very high risk. So we try to transfer that, refer it to the general hospital in need. And then other than that, we can do the telemedicine and mobile medicine. So this is the second case, OR room assistant with voice and gesture recognition. People who worked in hospitals before, and then they will understand the importance of the infection control and then the hassle when surgeons want to operate the images or DICOM images from real time, from the C-arm, from the MRI, from the CT. So how to do that? The toys from some companies might not be able to help. So we try to do that in a big context. Pre-operation, we do the analysis. During the operation, we can do the monitoring. And then post-operation, and we can do the summary and big data. So this is how we do that. And we designed our own device, and that one is something handy, beside the bed. And then we can use that during the operation. And we can use that just like this. Yeah, very easy. And then,
系统基于多模态交互技术，利用语音识别、手势识别、图像识别、视频识别等非接触式操作方式，通过自然语言处理技术，实现精准的人机互动，为手术室特殊场景打造，避免了因接触性操作或是巡回护士协助而非自主操作所可能引起的手术时间延长、感染发生率增加等问题，解决了医生在无菌环境和手术过程中的信息交互问题，解放了医生的双手，让隔空操作的科幻效果变成现实。这款智能化产品系统性解决了医生为手术期中术前讨论、术中查阅、挂片对比、报告查阅、设备控制、手术路径管理、专科手术大数据分析等重点难点问题。此外，系统还自带强大的3维图像处理引擎和3维手势控制设备，让医生对 CT 核磁图像的操作变得更为直观和自然，提高手术的质量和效率。
Thank you. We worked that out with our colleagues, surgeons, of course. And then they find that quite useful. And then the most important thing about this, it is not expensive. So most hospitals can use that. Yeah. That's the first thing we have to talk about. When technology, we want to deliver something, at least it is accessible. So, next thing, maybe we have similar things in India, or, same thing happens in China, of course. And then many people queue for the doctors and then just wait for 3 minutes conversation. Hard, very hard. What about our information technology? All right. Can we move that inquiries, a little bit forward in line of care before they come to our hospitals? Yes, we can. So we get the AI-assisted medical history collection app, so they can talk to the app, talk to the chatbot, and they can take the photos, and we can do the OCR, and we can get that examination, results. And then the most important thing is when we get to the doctor, to see the doctor, and the doctor can have a summary of all things they have talked about in the past. So it's not for patients, it's for the doctors. So technologies behind that is easy to talk about, like knowledge graph and voice recognition and the Chinese natural language processing, etc. But we do that from the imitation of doctors talking or inquiring the patients. So we have dealt with 27 major symptoms, in daily operations, covering all of that mostly. And then this is something similar to Dr. Peter Lee just presented, but we did that in our own engine, natural language processing engine. We've done the two-man identification, and we are working with more people in the same context, in conversation. The same thing, similar, we say, similar thing happens, just like we try to work out the summary after the conversation, and then saving the time of people like doctors, typing that in the computer. So we try to work that better from one-to-one to one-to-many in the future. So talking about accessible and affordable applications, mobile pathology and smart pathology is the first thing we talk about AI. So of course, just remember, a pathologist is very, very precious or very, in good need in China. So Xiangya Hospital has done this in the leading way in China. We've got over 6,000 cases in mobile and telepathology consultation every year, and it could be exceeding 10,000 this year. And what really works is that we've got a platform, cloud platform, to enable the whole process. And then it's a regional work, and then people cannot have the pathologists in their hospitals, and they can have that consultation remotely. And this is our technology. Auto slicing, and then fast scan WSI, and then we have that in mobile context for tele-reporting, and then trustworthy, of course, by a consultant, about 300 miles away, and then from the top hospital, and people will trust that in the secondary hospitals. This is our, those 4 screenshots, and that's our software system. Another one about the cancer screening. Cervical cancer screening, we have the 60 million women in China to be screened every year. And then normally, we can use HPV. That's recommended by WHO, but the HPV screen results alone cannot be conclusive. So in most hospitals in China, we use LBP, liquid-based thin layer pap test. So where's the problem? Because it is very, very high miss rate and low consistency and heavy workload, and few cytology doctors available in China. How to do that? So AI can help. This is how we work, yeah. And then we use the training data sets of 30,000 positive images and then 120,000 negative. And then we have the routine working now in Xiangya Hospital to deal with about 200 slices, 200 cases every day. And then before that, that's only about 100. I think in the future, we'll go up to 300 slices. So talking about the market, yes, we do have something like, 2 million in our area, in our Hunan province, to be automatically screened and then reported. In the future, we want to improve our positive detection rate and then try to get maximum throughput a little bit higher with the new machine. And then we try to lower the average scan and the diagnosis time from 60 seconds to 50 or even to 45 seconds. So this is the whole overall workflow. The last scenario I would like to present today is to deal with the integrated care in China for elderlies. We have 240 million people over 60 years old in China. That's about 1/3 of European total population. Very impressive. And then we have to deal with that. The people who is over 50 years old, they are the only section, age section, grows in the next 30 years. 30 years later, we're expecting something like 64% growth from today. So, how to deal with the gaps, how to deal with the imbalances in the elderly care, poverty, developing kind of levels in economy, and then what about the transport, and then we can deal with that with 5G, 4G, etc. But how do they seek doctors? So that's the problem. How can we do with that? So we have been awarded an MOST, National Key Project, with overall budget of 128 million RMB and led by Xiangya Hospital. Myself is the principal scientist in this project, and it is actually supported by 5 national centers for geriatric medicine and the Ministry of Civil Affairs. So these are the logos of 6 major players in this project. And then our major contributions will be specifications and standards. We have to understand where elderlies should stay in their home and when it should be transferred to hospitals for medical care. And we have to deal with the big gap in need of new medical nurses plus the carers. So we have to do the human resource training, for this context, and we have to find out the enabling technologies in an integrated solution. And then we have to find out the service models. This is our demonstration plan all over China. So for poverty areas, for poverty patients, we develop a powerful but useful service model for proactive healthcare. So $20 a year, they can do an annual health check. A modular cancer screen vehicle is in the middle, and the modular health check vehicle is designed on the right-hand side. So we run this over 4G and 5G in the future, and it goes to the rural areas, and it is going to be accessible to most people. And we have a helpful mobile IoT platform for health management. So these are the mobile devices and could be used at home and with our cloud platform for health management. And then the big data we have in our university and in our hospital is like this. We have about 5 million patients with quality clinical data, probably the largest one in China. And then that's accumulated in the last 20 years. And we've got 3 hospitals in line, and then that's the numbers. You can see quite a few. And then the medical data of all the diseases, including the skin diseases we just mentioned. And then we have the big data size in volume, a big pool of that. And then we have 10 standard data sets, and then 92 sub-data sets, including the skin diseases. And then we do have the largest skin health queue in China, and then with 60 1,000 skin health and disease-related biological samples, and then even the fridges, we have over 100 of that. So this is the picture library we just worked for the previous example or scenario. Talking about the future, and I think two things will be very important. Data is good, but we don't have to rely on the big data or very good big data, because the reality is there. We have to accept it, just like the Brexit. And small data, dirty data, or incomplete data, the reason why we talk about this is that I always say, don't be lazy, because when everything is there, why do they need us? IT guys, they don't need us. If everything is structured, yeah, doctors can deal with that by themselves. Why do they need us? They don't need us. So we have to deal with their hustles, yeah, do the dirty things. We try to work that out for the best. And also, inside the hospital and outside the hospital, consistency is the thing. And we have to get the quality control. That's very important in China, in developing countries, in Africa, in India, and then South America. So we do have the same thing, sharing in common. Yeah. And also, talking about the supporting technology, I would mention one new word today, which is HIoT. And then that will provide a better databases for smart care in the future. We are doing that now, and then the new thing will come out later this year. We'll probably talk about that next year, this time. And then what we are trying to aim today, using the HIoT, is to find out who, when, where, what, and how well they're doing, 5 Ws, and then capturing everything you do in the healthcare kind of practices. So H stands for hospital, enterprise level, HIoT, and then health IoT, works in GP surgeries, and then works at home, and then that's something we're on the move in transport as well, so that's health IoT. And then we have home IoT, because in the future, the home will be smart home. And we have a lot of devices and technologies to enabling artificial intelligence. So we have hospital IoT, health IoT, and home IoT. We call that HIoT. So we'll talk about this maybe next year if Inspired Minds invites me again. Okay. Thank you all. Thank you all.